All right, so this video is not in any particular type of order. It's just my complete observations about the doctor's office. So the way that I can see thus far that the surgeon does his um, process, because everybody's got like a pattern, a system, things of that nature to keep efficiency. So on Monday, Tuesdays, and Wednesdays, he sees his patients, whether that is post-op or pre-injury, whatever. He sees patients. And he also has a nurse practitioner. She's absolutely fabulous and she's so sweet. She's a physician assistant. She's a physician, excuse me, not a nurse practitioner. But nevertheless, so he sees patients Monday, Tuesday, and Wednesday. So for all those people over the weekend that think we're fancy and free or whatever, you're probably gonna get your appointment Monday, Tuesday, or Wednesday. Wednesday is and Thursday are kind of used for any follow-up diagnostics. For instance, on my particular Thursday, I had to get a CT scan. So I got a CT scan on my Thursday. But his surgery days are Thursdays and Fridays. And then they see patients in the evening. So they do surgeries in the morning, and then in the afternoon they see patients on Thursdays and Fridays. And so they work like a well-oiled machine. They got a system in place. It is impeccable. And I was appreciative to be on this side of that level of quality and expertise and efficiency, because I like me efficiency. I don't want to have to drag you to do all these little things for me. They are very efficient. They use my chart. When you first walk in, the first thing they say is, you want to register for my chart because this is the best and fastest way to communicate with us. And so I appreciate them, giving those hints, saying do this or that. This is just going to make your process more seamless. So I appreciate all of that. So really, really, really like that it was quick. They were intentional and they were amazing. The day before surgery, they put my orders in. So I had all my post-op medications sitting at my pharmacy so that when I got out of surgery, they were already filled and all we had to do is swing by and pick them up because the pharmacy had a half a day, if not more, to get them ready. And I didn't have to be waiting in line after we got out of surgery. So I like that factor too. I've communicated with them on line about several different things, handicap stickers. I did have 2 appointments before my surgery and they were on it like, do you need scooters is not covered by my insurance, so I had to pay for that out of pocket, but like, do you need a raised toilet chair? Do you need there were other things that my insurance would cover, so they were on spot on day one, like, hey, do you need this? Does your insurance cover this? If it doesn't cover, we sell this at this price, or you can look somewhere else for this item. Just giving suggestions on how to make life better, and I appreciate that. That was awesome. They were on it.